Good evening, everyone. I'm Dr. Brian Rieger from upstate in Syracuse, the director of the concussion program there and the co-chair of the Brain Injury Association of New York State Concussion Initiative. In that role that I'm here to welcome you to tonight's webinar, a retrospect and overview of concussion. And I know we have quite a diverse audience and a pretty significant audience in attendance tonight. So we're glad to see that, and we hope you find this informative. Dr. Flanagan just joined us. I'm going to introduce our panelists, and really the way we've structured this, we're really not trying to make this too preachy and teachy, but rather kind of a discussion, some shared experiences from people with different backgrounds and perspectives, people who are invested in this topic and spending time working on improving the management of concussion for our New Yorkers, our students, our patients, our workers, our athletes. And we're going to have a conversation that hopefully you'll get something from. And, you know, we're going to hopefully leave time at the end for questions as well. And you can send questions in. And if they kind of fit in with what we're talking about, I'll try to fit that in, but we can also just leave a little time at the end. So with that in mind, you see the slide in front of you that gives the names and background of our presenters. So we have Christina LeBeau from the Brain Injury Association of New York State, or BIANYS, Director of Advocacy and Engagement, Dr. Flanagan, who is the chair of the rehab department down at NYU Grossman School of Medicine and Rusk Rehab in New York. So he's a physician specializing in rehabilitation with a particular interest in brain injury, amongst other things, and a longtime affiliate with the Brain Injury Association. And then we have Jamie LaBarge, who's a principal at Stafford Middle School in Plattsburgh district up in North Country there. And also Jamie's a ref of high school soccer, high school and college soccer and basketball. I think I got that right, Jamie?
Yes.
Right. And so he has some interesting perspectives there. And then last but certainly not least, and the person we're going to roll with to start is Tina Sheehan, who is a physical therapist, I learned, but more importantly in the context of this webinar is the parent of a child who sustained a concussion and had what we would consider to be one of those complicated recoveries where, you know, they're not just back to normal within a few days. And her experiences have led her to want to become involved and advocate for change in this area and improvements. So welcome everyone to our panelists and our attendees. And so Tina, yeah, I'm going to put you on the spot.
Okay.
And maybe I can just, you know, maybe you can just very briefly talk about what happened. You know, we don't need a lot of details of the injury, but I think what we're really interested in, Tina, is, you know, what was it like for you and your daughter, your husband, your family to sort of go through this? What are the challenges that you see that make you so motivated to want to kind of improve things?
Yes, well, my daughter is 20 now, and she was injured when she was 16. And my husband and I are both in healthcare. And even despite our experience and knowledge in the system, it has been, to say the least, a struggle to navigate academics and medical issues and all kinds of things that come out of an injury like this. And so we're really, really excited to have discovered this organization this summer. And I wish we had it 4 years ago because, again, like you said, you know, concussion can be really difficult. Maeve, my daughter was injured, not sports related. And actually, she was an athlete, a sports athlete, but she actually got injured in a store when a bin fell on her head and knocked her unconscious. So that was when she was 16. anyone who's had an experience like this, I guess maybe, you know, first they expect it to go away, so they just think you can go back to school. It wasn't an on-school accident with, you know, sports related or not. So just the getting back to school, the awareness, keeping them up to date that she can't come back because she was still sensitive to light and sound, and the congestion in the hallways at the change of the bell, and the fluorescent lights are everywhere you go. You don't realize that until you have someone who's sensitive to all of that. And so it initially it was basically she ended up having to stay home her whole junior year and get tutored at our kitchen table because it was never worked out. That the system, she just didn't, all the things weren't aligned to get her the resources she needed at school. And I think because it started out as a concussion and we just kept thinking this is going to end soon and she's going to get back to herself. And so there was never a 504 because we just kept thinking, you know, things are going to get better, and they didn't. And so she entered senior year with a 504 and accommodations, and that made a huge difference. But I wish we knew at the beginning of junior year what we learned later, because it would have saved a lot of time. Unfortunately, she had to drop more challenging classes and things like that, and putting aside all the other impacts of having to stay home and go to school at your kitchen table with tutors and not being part of the sports and, you know, all the things that you're normally involved in as a 16, 17, 18-year-old trying to, you know, not only be successful academically, but just like exist as a normal teenager wants to be. And so I'm just really excited because it's so comforting to validate our experience here with people here that, you know, you tell them something and they're not shocked, and they certainly, it's not the first time they're hearing these descriptions of what, you know, she's experiencing and our challenges out in the world. You know, you could be with a neurologist, but if that neurologist really doesn't have experience in concussion and their focus is epilepsy, you might find, you know, your daughter taking anti-seizure meds, and then you realize, you know, 2 months down the road, that was a real waste of time and it gave other side effects. And it's just, you know, I don't know. I just am really, really, really excited to be here with you guys and be part of this, because I think that what you're doing is, I mean, if we were starting out now, I know our experience would be very different than what it was 4 years ago. So thanks.
Thank you, Tina. And you know, you've mentioned the challenges academically, socially. You briefly mentioned the challenges in terms of accessing medical care, and actually, you know, starting out, you really didn't think you needed much because, hey, this was supposed to go away.
Right.
You know, you're both in healthcare. Kind of, can you just speak briefly to some of the challenges you had there? I mean, other than, you know, your experience with the neurologist.
Yeah. So let's see. Well, again, it's hard to find the captain of the ship, and Albany has great health care, and my husband is a physician here. We can provide great services here in Albany, but it doesn't matter where you are. I mean, it just really kind of depends on the experiences of the people that are caring for the person with the injury, because if they haven't experienced it and their focus is on something else, then it kind of wastes a lot of time. So my daughter also developed POTS from the injury. So she started fainting, vomiting. She had never fainted before in her life until this injury happened. And then she started to faint. POTS is postural orthostatic tachycardia syndrome, for anyone who doesn't know. I know you all do, but anyway, she sustained more concussions because she would spontaneously faint. And so we navigated that, ended up with a cardiologist who punted us to someone else because he was out of, you know, it was not within his, he just, you know, couldn't help her. And same kind of things with neurology. We ultimately got to someone who was more experienced with the concussion. But I guess overall, the hard part the really hard part is putting it all together and trying to attend to all of the issues while keeping in consideration that she wakes up and goes to bed with a headache, B, has school to try to think of, and just it's just is hard to make to feel like a person rather than just a patient. And we had a lot of that, just sort of juggling or putting things on the back burner, like vision therapy, because that was very time consuming and very strenuous. You know, it's like any exercise, you kind of feel a little more exhausted and maybe some pain after you do it. And that's the same thing for your brain and for reading if you have a concussion, and to try to get people to understand that there's a real brain fatigue is a real thing. And sorry, I feel like I'm going all over the place.
No, that's
but
okay. I'll stop you there, but you know, that's great. Thank you, Tina. I think you really articulated a lot of issues that we can sort of talk more about during this webinar. So thank you, and jump in with other reflections. But you know, you were just talking about the medical issues, and you identified several issues. So I'm going to turn to Dr. Flanagan, who's the medical director, one of the medical directors, I guess, for their concussion center down there. Steve, listening to Tina, what reactions do you have and sort of thoughts? You know, concussion care has really evolved. It's not necessarily something that a lot of people get training in unless they seek it out. You know, give us your thoughts on Tina's experience and what you think we've learned or are learning from that. Yeah.
Yeah, so I think Tina's experience with her daughter is not atypical. We see this quite often. And part of the problem is that in medical schools, concussion is not taught. I got exactly, I would say, 5 minutes of concussion education in all of my medical school education. And it was a pediatrician asking what the diagnosis of concussion was. And quite frankly, what she said, I won't tell you how long ago I was in medical school. It was a lot ago. Probably wouldn't actually hold muster today. And that's just the problem. And even when you graduate from medical school and then go into your training, into your specialty in neurology or pediatrics or internal medicine, or even in my field in physical medicine and rehabilitation, the amount of education you get specifically on concussion is fairly limited. And now, of course, we want everybody with concussion to go see a medical practitioner, and there's just not a lot of education. That's changed somewhat in my field in physical medicine and rehabilitation. There's now a advanced training that you can get in brain injury, but the number of folks who are trained in that across the country is actually quite small. So I think there's still a fair amount of misunderstanding, even within the medical community, regarding concussion. And it really is important that when you do have concussion, as best you can, to seek out a practitioner who does have experience in treating somebody with concussion. Because there's so many things that you need to look at. It affects so many aspects of your lives, your cognition, which is your ability to remember and concentrate, your emotions. There's so many physical symptoms. Tina mentioned that her daughter had POTS, that postural orthostatic tachycardia syndrome, which is an abnormal cardiac response to just going from a sitting to a standing position. There's emotional issues, there's pain, there's headache, there's stuff going on in the neck, all of which comes together. So it's so important to see a practitioner that really understands what a concussion is all about and be prepared to provide education and treatment. The other thing I'd like to say about concussion treatment, as someone who's treated concussion for, closing in now on 3 decades, is that you've seen one concussion, you've seen one concussion. There's always a little bit of a difference between how everyone's going to react to a concussion. Some folks got that better quickly, some folks a little bit more slowly. But you really need to see somebody who understands it, who's ready to address the whole picture, and then to provide some guidance, education, and treatment. That was a very long-winded answer to your question, Brian. I hope that's okay.
No, that's great, Steve. And just to clarify for everyone on the webinar here, we do see that most youth and adults recover relatively quickly from concussion, and don't need a lot of specialized care. It helps tremendously if they do have even their pediatrician or their urgent care person who has some knowledge and can give them good advice. There's a lot of bad advice out there about concussion. So, you know, but even without specialized treatment, most people get better. When you don't, however, you know, it can be very complicated, as you saw, Tina, and it's hard to know when to seek out treatment, let alone when to find it. But another thing you said, Tina, that I want to bump to you, Steve, before we move to another panelist. Tina mentioned you really want a captain of the ship. And I think, Steve, you and I know that there's been a real movement arguing for the importance of an integrated sort of program for individuals who have a complicated recovery. Can you say a little bit more about that?
Yeah, that's so true. So I'll reemphasize what you said, Brian. The vast majority of folks who have concussion do get better and get better relatively quickly. But there is a significant minority that do go on to chronic symptoms. And when that does happen, it really takes a team to treat many folks who have more chronic problems related to concussion. And to have a quarterback or team captain or whatever term you want to use to make sure that, you know, that you're getting the right treatment, that is well coordinated, that the team members are speaking together is really ideal. Now that's easy for sure in a medical, in an urban setting where you have concussion centers. It's a little bit more challenging in more rural settings. But if I will say this, if there's one good thing that's come out of the COVID pandemic is that telehealth has become something that's much more available to people. So even in rural areas now, through telehealth, we can actually create this team. It can be a little bit more coordinated, but to have sort of that team captain, healthcare practitioner, a physician, whoever it is, who can coordinate it all, make sure the team members are talking to everybody so that one treatment isn't contradicting another, that information is the same across the board, I think is really very key. So Brian, that's an excellent point that you make.
Yeah, and like you, Steve, we're in an urban district and have an integrated center, but I do spend a lot of time with people, you know, with people who drive 2 or 3 hours from Plattsburgh or other places actually once in a while. And, you know, very often we end up kind of reaching out to the primary care physician and working with them to connect, help sort of point them what kind of resources to find in their area and sort of partner, because that's really what it takes. Is that my microphone making that noise or something else?
I don't know. This is Michelle. I'm going to go ahead and mute the other participants, and then they can unmute when you call.
So thanks, Steve. So Jamie, I want to go to you because Tina mentioned, you know, the difficulties with school, the difficulties even understanding what resources were available, I think you said, Tina, which was interesting. But that once you learned about that, it was there, but even knowing that it was there, let alone how to access it and how to access that support was difficult. And again, I think part of that was just taking a while to realize, wow, this is serious, we really have to do something. But even then, it took a while. So Jamie, from your perspective, does that, you know, how do you see that on your end as a principal and administrator in a school district dealing with kids who have these kind of needs?
Tina made many great points. In the last 3 years, 4 years since New York State has come out with you know, these mandatory protocols for students with concussions, it's helped out a lot. I think parents need to be, above all, they need to be their students' biggest advocate. You know, they need to talk honestly to the principal. They need to be in constant contact with the nurse, the school nurse, the school medical director if need be. And you know, if it's a short term, as you guys were talking about, which a high percentage are, it may take 2 to 3 weeks where we do not need a 504. Tina mentioned that her daughter ended up with a 504 plan. If it takes any more than 2 to 3 weeks or even a month, it's it's not a lot of work to put a temporary 504 plan in place, which would give the student the needs, breaks, maybe going into the nurse's office, sitting with lights off, giving them a little bit of break, leaving half day, attending in the morning, going home in the afternoon. What Tina said was absolutely right, and I think Brian may have stated, schools are full of fluorescent lights. Nothing worse than throwing a student who's had a concussion into a school. And in COVID days now, we all have laptops, so we're bringing devices in. We're looking at screens with tiny writing with fluorescent lighting above. So if a student has any kind of concussion symptoms, it's going to get worse for them. So be your student's biggest advocate. Talk to the principal. If they're starting to fall behind, tutors can be provided. You just, we work with the parents, but we have to know. Many times we see the other side, however, we see parents that students who are active in sports, they try and hide the symptoms of a concussion. So the state has done a great job in putting those back to play protocols in place. And I can say it's caused a lot of stress for administrators because parents get upset on going the other way, trying to say you're slowing my kid down. This is high school sports, and safety is of the utmost importance. And that's been a great help. But as far as academics go, tell the principal what your student is feeling. Tell the nurse what your student is feeling. If they can only handle 1 or 2 hours of screen time or 1 or 2 hours of looking at a book, then tell them that, and we will make the accommodations needed to make the student feel comfortable and be as successful as they can be at that point in time. And we can catch up. One of the things that we've done in the past is if it's 3 or 4 weeks that the student is kind of laying low, not doing a lot of work, we'll provide a tutor to catch the student up once they start to feel better. But for those weeks of where they can't, they want to close their eyes, they can't be in school, let them get better first, and then we'll worry about the catch up after. And we can do that. Schools can do that. And that's the big piece that we need. Now for the long-term ones, definitely get that 504 in place as soon as possible, and work with your school to do that. So
and Jamie, what kids returning to school, to the classroom, not necessarily to sports, has been a long-standing interest of mine. And one of the observations I have over the years that continues is just a lot of variation between schools, even within schools, between teachers. So what do you think kind of accounts for that? And what do you think, obviously you're, maybe because of your sports interest, you're obviously tuned into this topic. It's evident listening to you. Right. But what do you think is some of the work that still needs to be done there, I guess?
So I think we need to be transparent with the teachers. Tell them, your daughter is, Johnny, or your son Johnny's coming back to school. He is suffering from post-concussion symptoms. He may ask for, and the nurse may list breaks to come see me. Please be advised that homework may be turned in a little bit late. Give them a little extra time, time and a half to take tests, so on and so forth. Things that will just help them ease back into it. And they may come back to school. What we've seen before is they think, okay, I'm better. Come back to school, and 2 days later, just be right back out again, with the headache and the blurred vision and so on and so forth. And it takes a little bit longer, but teachers need to understand. And like I said, it's really helped in the last 2, 3, 4 years when New York State has put such an emphasis on this, because no one can ignore it anymore. And I think every building administrator, I know myself, being from the sports world, as you said, Brian, we see, there was 2 years back, we had a soccer player get directly hit, bang, face, high school soccer game, out cold, and got to him, kind of, you okay, no response, just laying there, called the coaches on the field, took down his number mentally, all right, and this is the second half of the game, and by the end of he got up finally, which to me wasn't right. But got up finally, went over to the bench. I thought we probably should have called the ambulance. And we went into overtime. It was a big game. It was a sectional game. And before you know it, to start the overtime half, I look and there was that number going out in the field. And so I called the other official over and we talked for a minute and we both had the same number. We went to the coach and they said, yeah, the parent said he's fine. And I said, no, medical director's not here. And that protocol saved us because the state had put that protocol. They had to be school medical director cleared before going in. And when the game got done, they lost the game. And they called the section and wanted to file a protest that we had kept that child out of the game. So, you know, we have to be careful. We err on the side of the student. They're student athlete, student being first. And you know, the state has really helped us out by making these protocols, and we're here to help you. And you know, it's same with the school. Next day, you know, if that kid comes back into my building, if he comes the next day, first thing that they're going to do is they're going to see the nurse. The coaches should be filling out a report. We should be looking into, you know, with the medical director, looking into what the next steps are.
So, Jamie, that's a great story, and I guess it's a perfect segue. I'm going to tap Christina here. She's like, I'm sure she's, you know, jumping in her chair to get on this one, because you're basically saying that if we put the right rules and guidelines and things in place, it actually makes a difference. And a lot of times people know what the right thing is to do, but you need a little coverage sometime for that, right? So Christina, I'm just going to take that right over to you, please, and pick that up and maybe talk a little bit what BIANYS is doing now, maybe a little history on the law and where we're going there. We can't hear you, Christina.
There we go. I'm like, Michelle, you need to unmute me, but she still couldn't hear me. I was chomping at the bit at every single one of our panelists. Honestly, you all did such a great job of teeing me up and my job and everything. And Tina and Jamie and Dr. Flanagan, thank you all so much for being here and being with BIANYS. Kind of to go from Jamie to Steve to Tina. Currently, we have just had introduced a piece of legislation that what Jamie was talking about was the Concussion Management Awareness Act of 2011 that was put into place by a senator that is no longer in the Senate, but it was a fabulous law. And at the time, it really did cover what the state of New York felt that they needed to cover, as far as like what Jamie was saying, taking the child out or the student out of the game. If they felt that they were concussed, need to see by a medical director. So our concussion initiative of BIANYS, Brian being a co-chair and Dr. Andy Hess being our other co-chair, we got together and decided that it's a fabulous law, the Concussion Management Awareness Act of 2011. However, it needs to really focus on exactly what Jamie said and being a student first. So we looked at the 2011 law and we decided we would make some changes and see if we could get introduced. And so the 2011 law does not talk about non-public schools and competitive sports and travel competitive sports. So we said we would like to look at non-public schools and competitive sports. We wanted to be sure that a concussion management team, exactly again what Jamie was talking about, we want the school nurses to be talking to each other, the coaches to be talking to each other, the teachers, the parents. We want a full team to be talking about what happens with that student, whether it's sports related, not sports related, it doesn't matter. A concussion is a concussion, and we want to see those kids back in the classroom. But in order to be back in the classroom, it's going to take this whole team of individuals to understand and to recognize what the student is going through. And another thing that Jamie said, the fluorescent lights, the bells ringing, and to Tina's examples, from what her daughter went through. There's so many things in a school that can be so distracting for a concussed student. Going a half day, making the font larger, any of those modifications, anything that we could do for a student, recommendations with the teachers. This is really important. We want to make sure that we really focus on a return to learn. So in our proposed legislation that has been introduced by Senator Hoyleman and Assemblymember Fall, we are looking at bringing that child back to the classroom so that they are in a full day of school before they can go back to the field, before they can start in their sports again. And we understand that we're going to get pushback from parents because sports are so important in a student's life. They really, really are. And we understand that, but so is in education. So we have that part of it. We also want to make sure that there's annual education for the medical director of the school. Currently, it's biannual. So we want to make that an annual education piece. We also want to look at if there's changes, we want to make sure that the coaches are aware of that on an annual basis and not a biannual basis. Understanding that there are some serious, and this year especially, cuts to schools, we really recommend that there's an athletic trainer available to all of our student athletes. We understand that there can't be an athletic trainer obviously available to all of our students, but make sure that there is one available for all of our athletic students. The last thing we want to do with this piece of legislation is we want to report the amount of concussions in the school districts. The reason we want to be able to report them and have them reported is that so we can go and visit school districts that maybe are having a high level of concussions and make sure that they are following protocol, make sure that they are following the education guidelines that we are providing them, and making sure that all of our students in New York State as a whole are safe, no matter whether they play sports or not, that all of our students are safe and they're all following the same protocol. So we have come together at BIANYS and the Concussion Initiative and really recognized that, that this is a huge issue right now in the state, as well as, the United States as a whole. The concussions are really holding students back in what they can do. And to Tina's point, that's one piece of our advocacy. So we're really pushing that piece of legislation. Like I said, it has been introduced in the Assembly and the Senate, and we are awaiting action from the education committees on both sides of that. So we're very excited about that. But to Tina's point as well, with her daughter, she explained that she felt like there was not very much help. She was unsure, and her and her husband are both in healthcare, and they weren't sure where to go. And we have a program that's also an advocacy program with BIANYS, and that's our FACS program, which is extraordinarily important for schools to know about, because we have FACS coordinators around the state. We have 8 FACS coordinators, and FACS stands for Family Advocacy, Counseling, and Services. And that's a program run right out of our office. And like I said, we have 8 counselors and coordinators around the state, and they can do exactly what Tina needed. They can come into the school and talk to the parent, talk to the teacher, talk to the concussion management team, all of those things, and really do almost like a whole hand holding throughout the entire process. And I learned about Tina's case, funny enough, 6 years ago, or I'm sorry, 4 years ago, before I was even with BIANYS through a friend. And, back then it was just hearing about this student that was really struggling. Lo and behold, here I am. And it really connected Tina and I and her daughter. And I'm so thankful for that. And she said, "Where the heck were you?" So BIANYS has so many different programs that can really, really help so many aspects of a concussion. And to Dr. Flanagan's point, the other thing that the Concussion Initiative is doing, we're working on grants to do exactly what he was talking about. Is he got just a few minutes of education when he was in medical school. So we're really looking to train and educate medical providers as well on concussion. So we have so many things. Dr. Rieger, I could go on for the entire hour. So I'm going to stop there. Perfect. But to all of you panelists, we really do have so many positive things going out of the BIANYS office.
Well, and the only thing I would ask in addition to your comments is that we have been training teachers under a grant as well. And so, education is really critical. Anybody who works in concussion realizes that, the starting point is just knowing what you're dealing with and having some background, whether you're a medical professional, an educator, a parent, or an advocate. Getting that education is key. So BIANYS plays a particularly crucial role there. I do have a couple questions that come in that are right up our alley here. One question was, how do you find that captain of your team? Christina, you kind of answered that question, that BIANYS has the FACS coordinators. So you can always reach out to BIANYS and say, "Hey, here's where I live. Who around me is is somewhere, where can I find help? And Steve, I don't know if you had anything to add to that, advice of a parent, looking for expertise. Is there just one specialty, or, do you just call the hospital? Where do you go, Steve? Oh, can't hear you.
I am now unmuted. Okay, thank you, BIANYS. So Brian, I think you have a great idea. Certainly New York State, reaching out to BIANYS. They are a tremendous source of information and guidance. That's certainly been my experience in my nearly 3 decades in working with them. And really ask questions. There's no one specialty that I would say that owns concussion. By and large, I would say that, for physicians, it probably is predominantly neurology and physical medicine and rehabilitation. That's my field. But also go online. I will say that many people find me by just going online or Google or whatever search engine you have and seeing where the concussion centers are close to where you live. There are some practitioners who have made it a point to understand concussion. BIANYS may be able to help with that. But those practitioners who are in the community have, by and large, identified some other specialists like a physical therapist, occupational speech therapist that they develop relationships with. Requires a little bit of work, but you can find them out. If by chance you can't find somebody, oftentimes reaching out to a major medical center that does have a concussion center and ask, who's available in Western New York? And you'd be surprised that we do know some people. So although we can't provide it, somebody else can. And as I said before, there's the opportunity now that we didn't have before of telehealth, which really does expand our reach from the major urban centers into some of the more rural ones. So those are just some tips to help you find someone who can help you.
I agree with that. Often when I have patients who are moving to a different state, I say, contact the concussion centers in the nearest big city. Tell them where you are and who do they know, because you'd be surprised what a small world concussion can be. And I guess, yeah. And someone who sits kind of in the middle between the medical and the educational is often that school nurse. So Tina, one question that came up was, what was your experience with the school nurse? They often can be that person who really kind of gets it and tries to advocate. And if you don't have that nurse, sometimes it's a challenge. What was your experience there?
The nurses were they really tried. But again, I truly believe that after this education that you guys have gone in already since my daughter was there. And I think with them knowing now what they didn't know then, I think it would be really helpful. It was we were kind of learning together. And again, with my healthcare background, I felt like I was probably a more stronger advocate than your average parent. But it just was, it was organizing things like you had said about being able to go in and take a rest during the day, or discussing. I think one of the important things is, and it's, ironically, I had worked with a lot of people with head injuries, and, and mostly when someone gets a concussion, they have to lay low and stay in the dark. And, after a few days, once people start to return to life, hopefully everything goes seamlessly. But surprisingly, I think as a parent, don't ignore subtle difficulties, because things come up. The more they try to do, if there's an issue there, the more the issue is then revealed. So that's what happened with us. I mean, Maeve walked out of the house and it was sunny out, and it was as if somebody had thrown acid in her face, and we were very taken aback by that. So I guess just as a parent, be receptive to any kind of, complaints or whatever that your student might have with some of these things that maybe get revealed later. Maybe, they haven't tried to read because they've been at home, and now they're starting to go back to school. And I feel like the visual issues are really overlooked. And maybe that isn't the case now, but that's been our experience. And, you can go into a neurologist and they ask you to touch your nose and walk a line, and that's great, but that doesn't help you when you need to read and comprehend and study and take tests and do all of those things. If you're having visual issues or you have a headache, I mean, the closest thing I can relate it to is someone who has jet lag and an abscessed tooth at the same time, and trying to go through life with a smile on their face and function, because I think that's what it probably feels like. And it's such an invisible injury. And I mean, it's hard enough, I think, if you're a 50-year-old woman. Imagine being a 16-year-old teenager trying to navigate everything that they have to navigate, and then feeling like that on top of it and not being understood and looking completely fine. And I think those are the things, that awareness is, just really important for everybody who has a loved one, whether, it's your loved one or you're the school nurse or you're the counselor or you are a friend. I think that's the biggest thing is, even the more they, if there's issues, it's to us at least, the more you try to do, the more deficits were revealed. And keep your mind open to that, because like everybody expects concussions to get better in a couple of weeks, and maybe it doesn't. So, I mean, when it doesn't, I guess, just be open to it and try, and then advocate. And don't forget to advocate for your child at the doctors. If they're not focusing on the issue that your child is having, then you need to speak up. And that's what I finally did after the nose touching and line walking. I said, could you please ask her to read this sign on the wall? And she couldn't. And there we go. Now we're going to address this issue. But it was completely ignored for 3 to 4 months. Every visit, the same kind of testing. And so, and I'm a physical therapist. I feel terrible, but it's your child, and you don't think, I don't know, it's just different. And so I just encourage you to pay attention and use these people and all of our experiences.
And I think if I can add, Brian, just real quick, she made a great point. The extended time that I talked about before, it needs to be kept for a while, even though your student now is returning to a full day of school. Let's say it's 2 weeks and now they're back in school. They have just went through 6 hours of looking at a screen, being in fluorescent lights, and now you may expect them to go home and do 2.5 hours worth of homework. And
Yes.
That's the piece where you need to advocate for your child, that they have extended time to get their work done, because it's great that they got back to school and it's great that they made it a full day, but then to throw 2 more hours at home, it's going to lead to regression probably back again, and that's what we don't want to see. So.
And Tina, you made several times, you've talked about this process that you were going through, where you, as a caring but sort of uninformed parent health person, right, and your daughter herself discovering problems through the process.
Yeah.
I think Steve and I can tell you that's a very common experience, that this is an injury that evolves with time. And I think it's one of the challenges that we have very little objective medical evidence. Most of our medical tests don't really show much, and it's really listening and talking to the patient and the parents often is what we have to do to learn this. And even they sometimes don't even know what to tell us, because they've never gone through it before. So it argues again for the importance of getting that training. I see you shaking your head, Steve. Did you want to add anything to that?
Yeah, so I think you're absolutely right, Brian. So there is no diagnostic test for concussion. That's really part of the problem. So it really does require, really listening to what the symptoms are and putting those pieces of the puzzle together. I would also add that part of our job as practitioners is to educate not only the patients who have concussion, if those symptoms are lasting particularly a long period of time, but also those folks around them. And the one piece of advice I would give folks, and I'm sure Tina would agree with this, is that the only bad question to ask a physician is the one you don't ask. If you have questions, you have concerns, ask them. There's no such thing as a bad question, because concussion is confusing, and we're still studying it. So if there's something that just isn't right, go ahead and ask. Because when you do ask, that gives us the opportunity to provide our insights and potentially some treatments and solutions.
And Jamie, you know, one of the problems that I see in schools, and again, you know, you're obviously informed and invested and have made an effort there, but you know, even as a parent, and Tina, I'm sure there were times where you were probably wondering, is she making this up? Come on,
Yeah.
like even as a parent who's watching their child suffer, you know, you can't, because she's good one moment and then the next minute she's not, and maybe it's just adolescence, you know, so it's hard enough as a parent. And I know many teachers can be very skeptical about what's going on, and I know some school districts, parents really have to fight to get some of even the most basic understanding and recognition. So, you know, what thoughts do you have about that, Jamie? What would you encourage parents or students to do in their school district if they don't run into an administrator like you, who's, you know, kind of ready to help? You know,
well, I think what they need to do then is that they have to get the 504 plan in place that is backed by law. And if they don't follow the 504 plan, then you know, they're in legal trouble. So if your administrator or your nurse is not, or your teachers, I should say, are not following the plan, then I think your wishes, then I think you aim and you shoot for the 504, and it can be a temporary 504. You contact your district administration and you say, I want to know who the 504 coordinator is for the district. They'll give you the name, and reach out to them, tell them what is going on, and that we, you know, and if you've like had trouble, if you're frustrated, just say, look, we've been at this for 3 or 4 weeks. We don't think they're taking care of this, or 2 weeks even. We don't think that they think we're serious with this. We want a temporary 504, and they, you know, your doctor can write you a note, basically saying, you know, that you are indeed welcome to a 504, and that's the best thing. We can't deny it then, and you know, that's a good thing. And I don't think there's any doctor, when a student, and Steve and Brian, you can kind of tell me, when a student is complaining of these, and they shouldn't have to, symptoms, and we know that there was, you know, some kind of accident or something that caused it, that's going to say, no, you can't have a note. And, you know, one of the things school districts are doing now is they're not taking like these long notes. We used to get a note from a doctor, and you know, there was never an end date. I know our school, Plattsburgh City School District, now if you get a note from a doctor, we're having it reevaluated every month. So 30 days, you know, you're going back to the doctor, you're going to get us another note. And that's one way that, you know, we can keep track of it, and doctors keep track of it. And I would think if it's a significant concussion, they're going to want to see that patient, you know, within those 30 days anyway. So they're not going to let it go too far. But
so
just be your advocate. Just advocate. If you're not getting anywhere with your building principal, go to the district, go to the superintendent, find out who the 504 coordinator is, you know, and you know, make contact with them, and you know, have your doctors ready, and you know, write the notes and go from there.
Great, thank you, Jamie. So we're coming up near the end of our time here. One question I did want to briefly address before we wrap up. One question that came across in advance was concern about concussion and the risk of long-term neurological problems or dementia, or so-called chronic traumatic encephalopathy, especially with multiple concussions. This is something that, you know, the movie was called Concussion, but it should have been called CTE with, was it Will Smith there? Yeah, you know, it really was more about this concern for the effects of repeated head trauma. So I'm going to briefly address this and let Dr. Flanagan say something too. But basically, what my message is that there's a lot we don't know about the long-term effects of concussion still, and there's a lot we really don't know about CTE and the connection to concussion and head trauma. That's not to say that there isn't a connection, nor that we don't need to take that seriously, but there's a lot we don't know. Probably the risk is lower than what a lot of people think if you just read the news. And so I think we have to wait for the research to help people like myself give better advice. What we do know is how to manage concussions when they occur. And that we have very good experience with, years of return to play protocols, you know, telling refs and coaches to pull people out of the game. When in doubt, sit them out. We've been doing that for years. We know what happens if you don't do that. Those are the people who end up in our clinics in New York City or here or wherever, where the concussion wasn't managed properly. Sometimes even a single concussion can lead there, but more often those complications come when we haven't done the right thing. So we know how to manage concussion, and we also know that exercise and sports are great for our students and our youth. So we want to make sure that while we're appropriately concerned about the health of the brain, we keep that in perspective. And that's my 2 cents. Steve, did you want to add anything from yours before we close?
So yeah, Brian, I think that you really hit a lot of the topics well. You know, there's evidence that's coming out to suggest that more severe traumatic brain injury may be associated with earlier onset dementia in some people, but even that evidence is not pure, and there's a lot of complicating issues with that, so we're not even sure there. The evidence for mild TBI or concussion is even less certain. But we do know that, you know, having multiple concussions are not a good thing. And we've known since the 1920s that boxers have gotten hit in the head over and over and over and over and over again. That's not a good thing. But a single isolated concussion, you know, I think that there's no good evidence to say that that's going to lead to dementia later on in life. And, you know, and I think that you really hit it on the head. Oh, bad terminology, my apologies. You hit the nail by saying that exercise and team sports just add so much to growth and development, that there's so many benefits to that, that we really have to, you know, look at the entire picture. But we don't know yet. In fact, I'll be on a study panel looking at potential grants, looking at the association between TBI and dementia beginning tomorrow. So this is still a very active area of research. We don't have all the answers yet, more to follow, but be safe and continue to exercise. And if you have a single isolated concussion, don't get another one if you can, and exercise, be healthy, and do all the other right things.
Great, thanks, Steve. Well, I want to go around and give everybody a chance to sort of give us their final thoughts. We've got just a few minutes, so take 30 seconds. And that was your chance, Steve. You didn't know it, but you did a good job there. And we'll go across on my screen. Jamie, from your experience, whether on the field or as an administrator, as whatever role you're in, what are your sort of final thoughts or comments, or what you'd like to see BIANYS focus on? You know, what would you say?
2 things. From a school point of view, advocate for your child. I can't say that enough. If they come back and they are not feeling 100%, you know, let the administrator know. You know, maybe half days. I'm big on the half day thing. Let's try it, see what happens. And maybe they come 1 half day, and then I get a phone call from a parent saying, didn't work, headache was really bad. Okay, let's take it a little more time off. You know, advocate. From the soccer and basketball point of view, having done D1, D2, and D3, I have never seen a student athlete with a moderate to severe head injury come back in a game. I am so glad that high school has gone to the New York State has put that rule in, because in high school games in my 20-some years, I have seen kids with head injuries, coaches put them back in because the parents are pressuring them, and they give in to the pressure. So just remember that if they're not doing it at the higher levels, I know parents, high school sports are important. Steve said you know, he put it perfectly. They do a lot of great things. But, you know, your child's overall health may be at risk if we try and rush them back too quick. So.
Thank you, Jamie. Christina, there are a lot of good things that have been going on that we've been doing over the years for concussion. We got a lot of work to do. I think we're all going to agree with that, but obviously there's a lot of positive we can take from this. And you, I think, see that work in the trenches. So what are your final thoughts today, Christina?
One of my final thoughts with all of us here is education. And so many things that Jamie has said. Our grant program through the New York State Health Foundation, one of our colleagues, Michelle, has gone through New York State and trained many teachers, school nurses, psychologists about concussion and the different changes that they can make with the students, as far as, like Jamie said, the half days, larger print, like I had said before. So there's so many different things going on, but education, I really think, is the number one for practitioners, for school personnel, for parents, for coaches, and for students, because students feel like if they do get hurt, is it bad if I say something that my head hurts, that I may have a head injury? Am I going to be labeled? All of these things. And it's all just going to take education over time. And we can't stress that enough, that at BIANYS, that's one of our main focuses, main goals, is to make sure that everyone understands, number one, that we're here and that we are a resource. And please just call our office. And in the schools, if we do have students that are concussed, please call our office and we can hook you up with a FACS coordinator and hopefully go on from there. But in my last second, education, that's my number one.
Thank you. All right, Tina, you teed us up very well tonight, and we're gonna let you have the final putt here as well. So, you had a very challenging experience with your daughter and your family, but honestly, you clearly came out of it motivated and energized. So, you have a lot going there. So, what do you want to close us with here?
Well, I feel like we've been out in this kayak in the ocean, and now you all just lifted us up onto your ship. That's how I feel. So it's just, I think exactly what Christina said. The awareness would make all the difference in the world for someone in that, dealing with the concussion, with post-concussion syndrome issues, and just awareness for the public, for the teachers, for everybody, medical staff, like you said. It's just, I think, we all know that neuroscience has increased the knowledge in the last 10 years, and I think even the last 5 significantly more, and I think it's just going to keep getting better, and hopefully we'll all benefit from that. But I just want to thank you all for what you're doing, and I'm excited to be part of this because I think it will make a big, big difference. I think it's great. So thank you for what you're doing. And Jamie, you really should speak to all your peers, because you're so aware of so much. And I am a dear friend of our principal, but it's the system and the awareness. And I'm sure they're much better off now than they were 4 years ago. But thank you for what you're doing, and keep sharing that at all your meetings, because it's important.
Thank you,
Thank
Tina.
you.
And yeah, hopefully everyone is a little more aware after our webinar tonight. So in that night, we'll close it up. Thanks to our panelists, all of you. And I hope this was informative and interesting to our audience. So good night, everyone.
Good night.